Hi, my name is Peter Vernizzi, and welcome to my channel, Therapist with Tinnitus. And on this channel, I'll be offering information on tinnitus from the perspective of a mental health professional. If you like the video, click the like button and subscribe to be notified when more videos become available. So today I'm going to talk about some of the research that's been going on with the concept of mindfulness and tinnitus. And this was sparked by a recent NPR story about mindfulness and tinnitus. And I'll put the link to that at the end of the story. So I went and dug around in the research and we'll go over what I found. I started with a 2019 review article, and this is a look at all of the quality research that had been done on mindfulness and tinnitus through 2019. So it's fairly recent, and there were some really very promising conclusions. So overall, the article concluded that there was a decrease of tinnitus distress scores in MBIs, and those are mindfulness-based interventions, and I'll be talking about what those are in a second. A decrease of tinnitus distress scores can be observed directly post-therapy based on moderate to high quality studies. And there was no effect of mindfulness-based interventions on depression and anxiety in tinnitus patients, which isn't surprising because as standalones, that's not what they are intended to do. So a word on this term MBIs, mindfulness-based interventions, that just refers to the type of mindfulness training that was used during the study. And there are three major types of mindfulness trainings used. The classic mindfulness training, mindfulness-based stress reduction, has been around now for more than 40 years. It's been the basis for many of the studies which found benefits in mindfulness, and it consists of an 8-week class that meets 2.5 hours once a week with an 7-hour retreat between the 6th and the 7th week. The other two types of mindfulness trainings are actually based off of mindfulness-based stress reduction. So mindfulness-based cognitive therapy, which focuses more on thoughts than on kind of the whole body experience of MBSR, and a much more recent version of MBSR, which the authors of the review study just lumped in with MBSR, a mindfulness-based tinnitus stress reduction. There was also a couple of studies which used none of the above, had a kind of a vague notion of mindfulness they seemed to apply, and a couple of studies used shortened versions of MBST. The interesting and important part here is that there was really no difference between the type of mindfulness training between any of these. So, which isn't surprising because they all more or less accomplish the same thing, and they are all more or less versions of the same thing, MBSR. So let's also start to look at the literature, and I'm going to start by looking at the three papers that were what we call randomly controlled trials. And these are the gold standard in research. This is where you compare one treatment against another treatment to determine which one is best. And in all of the RCTs, as they're called here, what was compared was mindfulness training against relaxation training. So I'm going to look at those three studies first. And I'll have the full references available at the end of this presentation. So the 2012 study, randomized controlled trial of mindfulness-based cognitive therapy for treating tinnitus. Try saying that 3 times fast. So in that study, 25 participants were divided into 2 groups. One group was given 6 weeks of mindfulness training, and the other was given relaxation training, which is just a basic strategy teaching how to relax, body massage, some meditation, and other techniques for relaxation. Each group was given 2 hours of psychoeducation about tinnitus 2.5 months before the training, and there was a follow-up 3 months after the training. Now, one of the issues here is studies use various measures to determine whether tinnitus symptoms went down. This study was called QIPA, Tinnitus Psychological Impact Questionnaire, which was developed by the authors, but there's an internal consistency in that as long as the study uses the same questionnaire, it should give a level of as I said, internal consistency. Importantly, though, that this did not use the full 8-week protocol for mindfulness training. It used 6 weeks instead of 8 weeks. So take that into consideration. The measure focused heavily on two aspects of tinnitus: frustration and rumination. Frustration is being upset about your condition, and rumination is just focusing on it. Rumination is really a heavy factor, for example, in depression. So some of the findings first concluded that psychoeducation diminished the feelings of frustration, of tinnitus, but the effects of psychoeducation were maintained in the mindfulness group, but not in the relaxation group. An advantage to mindfulness. And again, psychoeducation, just teaching people about their condition, reduced rumination, reduced the amount of time people spent focused on their condition. Again, the mindfulness group continued to capitalize on the benefit, whereas that is, it got stronger, whereas the initial benefit of the training, the psychoeducation, just was maintained in the relaxation group. So, overall conclusions of the authors: mindfulness training appears to have brought either postponed improvements or a better maintenance of the benefits of psychoeducation as compared with relaxation training, and the present results are congruent with the notion that a reduction in analytical rumination and acceptance are among the most active processes in the mindful intervention. So mindfulness, although both mindfulness and relaxation therapy helped, unsurprisingly, mindfulness was seen as statistically superior. A second study also used what's called MBCT, Mindfulness-Based Cognitive Therapy. And in this 2017 trial, 75 subjects were used, 39 used mindfulness-based cognitive intervention, 36 used relaxation therapy. The reason for the uneven number is they started with a larger number of evenly divided patients, but because of dropouts, this is what they ended up with. Both treatments involved 8 weekly 120-minute sessions, so they did the full MBCT, and also 8 weeks of relaxation training. One or the other. Assessments were completed before starting and at the start of therapy, and at the conclusion of therapy 8 weeks later. As I said, it used the full MBCT protocol, and something called the Tinnitus questionnaire was used to assess improvement on tinnitus distress. This is a 41-item 3-point scale, which according to the author, and I'm in no condition to judge, I haven't done the research on this, claim it's a high retest reliability, which means it stays the same after test, and internal consistency. It doesn't contradict itself at any points. So this test, again, looking at relaxation therapy versus mindfulness training. Both groups showed a significant reduction in tinnitus severity, but this was significantly greater in the MBCT group. This study shows that MBCT, mindfulness-based cognitive therapy, is more effective in reducing tinnitus severity than both a waiting period, which is also used as a control in this case, and an active treatment of equal intensity, and this is relaxation therapy. After receiving 8 weeks of treatment, patients in the MBCT group reported significantly less severe tinnitus with a moderate effect size. And one might explain the higher results here in that they did the full 8-week protocol with MBCT. And in fact, the authors of the previous study even noted that this may have been some of the reasons they did not have an equal more impressive result, although it was still impressive. The third study we're going to look at, a randomized control study of mindfulness meditation versus relaxation therapy. Again, this is another RCT, and in this case, 86 patients were recruited, 34 completed mindfulness meditation, and 27 completed relaxation therapy. You can do the math and see where the dropouts were. Each patient had 5 face-to-face sessions of 40 minutes of relaxation therapy or mindfulness meditation over a 15-week period. So decidedly less mindfulness training than in the previous 2 studies. A different reaction, a different measurement was used. The primary outcome was the Tinnitus Reaction Questionnaire, which is a 26-item self-report that covers various elements of personal and social handicap associated with tinnitus. And the conclusions here was the mean difference in scores post versus pre-treatment change was greater in the mindfulness meditation group than in the relaxation therapy group for all outcome measures except health status indicators, so all outcomes relevant to tinnitus. Although a difference in tinnitus reaction questionnaire, that is an improvement, was apparent in both groups, the difference was significant, statistically significant only for the mindfulness meditation group. So while the relaxation group improved, it wasn't enough of an improvement in the relaxation group to be considered statistically significant. So all 3 studies, randomly controlled trials, show advantage mindfulness compared to relaxation therapy, and the fact that both improve one's assessment of tinnitus. So the 4th study we're going to look at is one by Jennifer Gans, who did the 4th study, is the one that used a mindfulness-based stress reduction therapy. The only one of the 7 studies that use pure MBSR, that is the classic 2.5 hours for 8 weeks with an extended meditation retreat between the 6th and the 7th week. So this was 13 adult participants, a much smaller number than the previous studies. And as I said, they conducted the 8-week MBSR program. There wasn't any other method that was used to test against. It's just testing, does MBSR, mindfulness-based stress reduction, improve our assessment of tinnitus? The primary outcome was yet another tinnitus measurement. We've had 3 if you're keeping score, well, 4 if you're keeping score actually. And this one is the Tinnitus Handicap Index and the Tinnitus Functional Index. So it's kind of hard to keep track of all the measures. But again, as long as there's an internal consistency, it's not that important which one gets used. And this one is also interesting because it used fMRI, functional MRI machines, to look at the brain changes as a result of the training. And this is something that there's been quite a bit of looking at MBSR, mindfulness-based stress reduction. A lot of studies have looked at how this changes the brain and the whole fascinating field of research there. What this does, this is the only one that looked at the changes in the brain in mindfulness working with tinnitus. So very interesting. And the results, to quickly throw it at you, were at the 4-week follow-up assessments. 8 patients, 62%, had achieved a clinically meaningful reduction of 13 points or more on the tinnitus functional index. At the follow-up, 10 patients had achieved the clinically meaningful difference, defined as 7 points on the scale. And then the fMRIs, this is a really interesting part, which I can only kind of hint at here. There was changes in functional connectivity within the regions associated with the known attention networks. And we're not going to be able to dig into the details. Maybe at another video we can talk about the possible changes of mindfulness and how those changes in the brain might impact tinnitus. But this importantly did find changes in the brain associated with mindfulness training in this tinnitus scenario, which is not surprising because mindfulness MBSR studies for years have found changes in the brain. But putting two and two together here, these results suggest that the subjective improvement on the tinnitus scales can be connected with altered neural connectivity. So there's a possible causal explanation here. But again, this is more of a hint than a depth research issue, but an interesting one that connects with other research in MBSR. Now the fifth study is the Jennifer Gans one. She is interesting because she has piloted or programmed her own version of MBSR, Mindfulness-Based Tinnitus Stress Reduction, which is now an online course which you can sign up for and pay, I don't know, I think it was $300 or something like that to take the 8-week online course. In this study, 8 patients who had previously received tinnitus counseling were put in this MBTSR program, which is essentially a version of MBSR, the classic mindfulness-based stress reduction, with some tweaks for tinnitus. The program again included the classic 8 weeks of group instruction, the 1-day retreat, everything that you usually do in an MBSR course. The primary outcome measure here was the tinnitus handicap inventory. So what happened as a result of these 8 patients doing the tinnitus-based, mindfulness-based stress reduction? The conclusions were quantitative results indicated this is the numerical on the numerical change on the THI, indicated that there was moderate to large improvement with respect to tinnitus annoyance and awareness, increased mindfulness, reduction in mood disturbance, and meaningful improvements in patient well-being and quality of life. And qualitatively, that is, they had a number of comments on the study, people talking about what the impact of the training was for them. Overall, a tinnitus perception shift, a reduction in psychological distress, increased mindfulness, and improvement in general functioning can be surmised from participant comments. So very positive conclusions from that study. So the next study we're going to look at, we have a couple more left. Mindfulness-based cognitive therapy. This is again MBCT. That's a lot of initials to keep track of. Don't worry about it. They're all MBIs, mindfulness-based interventions. So this is a large-scale sample of patients. This is the largest study of any of the above. I followed MBCT on 205 patients, with 188 completing the program. The TQ, the Tinnitus Questionnaire, and the Tinnitus Acceptance Questionnaire were used as the measures, primary measures for tinnitus in this research. So in this conclusion, 50% experienced a reliable improvement in their tinnitus distress from pre to post-intervention, and 52.8 of participants experienced a reliable improvement, and reliable is in terms of statistical analysis. From pre-intervention to post-intervention, 75% at least some improvement in psychological distress. Overall, MBCT led to significant reduction in tinnitus-related distress and psychological distress in patients with chronic and distressing tinnitus. So again, more positive news from another mindfulness study. The last one we're going to look at is was actually the first one done, it seems, and at least this is what the literature tells me, and I'm going to believe them. In this case, 25 chronic tinnitus sufferers were consecutively allocated to 2 groups. One received CBT and meditation, cognitive behavioral therapy, and meditation in 4 one-hour sessions. The other group waiting 3 months and then being treated in the same way. So you have the first group actually being a kind of control just by means of waiting, and then they get the study as well. Now, what's interesting here is we don't really know much exactly what was the training they were given. It just says CBT and meditation. It's not one of the classic MBCT, MBSR, MBTSR. So I think this is because it was a very early study, and those parameters hadn't been set for what should count as mindfulness training. So very, again, loose type of training in only 4 1-hour sessions, so not a lot compared to what the other studies used. And what was used for the measure was, again, the tinnitus questionnaire. We've seen that before. I got out of hand. This is the NPR study, in case you want it. This little bit out of sequence there, but you can look at the NPR story, and we can go then to conclusions for study number 7. The control group showed no significant change while awaiting treatment, but once they got the treatment, they improved greatly, which you would expect, but it's nice to see that borne out by the research. The active group, that is those who actually, after they did the mindfulness and cognitive therapy, made significant positive changes across all variables of the subscales except for the effects of tinnitus on hearing, and we wouldn't expect mindfulness training to affect the tinnitus and hearing. The control group, again, showed no significant improvement while awaiting therapy, but significantly improved post-therapy apart from the relaxation response. At the 4 to 6 month, 80% of the patients reported they were better or much better. So that was the first study, and it was fairly positive, and all the studies were positive. There are the complete references. So, overall, great news. Mindfulness training, again, not just any old mindfulness training. It's best to engage in one of the certified mindfulness-based interventions. Can have a real positive impact on how we deal with our tinnitus. So this is, I think, a clarion call that we have another tool in our toolkit for dealing with tinnitus. Mindfulness is something you can sign up for an MBSR course. 8-week courses are popping up now that the COVID is going away. Hopefully we have more in-person classes. There are a lot of online classes for MBSR. There's also a free version of MBSR at palouse-mindfulness.com. That's PALOUSE mindfulness.com, which I can highly recommend. But always better if you can do it in person. So I hope that was helpful, and good luck. And again, if you like the channel, subscribe and keep on going. Bye.